Hello, my name is Lauren Parks, and I will be informing you on the lives of physical therapists. What's a worse feeling than getting injured and not feeling like you can come back from that injury or setback within your everyday movements? Some of you may be wanting to pursue physical therapy and want to know what it takes. Physical therapy is the best option that will assist with easing pain, helping you function, move, and live better. These licensed physical therapists attend specific graduate programs to get quality education and training in physical therapy. They also pass a national exam to get certified. The person I have interviewed is Dr. Brad Baker. He is a DPT and graduated in 2005 from Elon University. He also obtained his bachelor's at the University of North Carolina at Greensboro. I know many of you have been injured and with post-injury have felt the emotion of being hopeless and felt that your athletic career is over. Some of you may be wondering how physical therapy is beneficial to bring you back to the state of wellness that you want to achieve. At some point in life, a physical therapist will be needed, whether it is for an injury, post-injury, impaired movements from age or disorder. Physical therapists have a variety of different obligations and tasks to complete, while also trying to provide quality care to patients. In this speech, I will cover many aspects of physical therapy, how they evaluate patients, the obstacles they are faced with, as well as how the exercises are planned when clients come in. How do physical therapists evaluate patients? Physical therapists generate diagnostic hypotheses and select specific tests to identify signs and symptoms. According to the article, Physical Therapist Examination and Evaluations are not a linear process. In fact, it is ongoing and begins with the first contact with the patient. History is taken to reveal past injuries and past health information. This history includes an initial investigation of symptoms that will be further explored during the examination. Determining symptoms is important to determine the type of tests and measures that will guide the examination. Evaluating a patient is the most necessary step in the process for diagnosis and prognosis. The history also includes a review of symptoms that are further explored during the examination. The review of symptoms includes physical findings and the patient's response to more specific questions. This information provides alternative explanations for the symptoms reported by the patient. Physical therapists synthesize collected data and determine whether the potential or resistant disorders are manageable within their scope of practice. The test will identify, confirm, or rule out the presence of relationships among impairments of body structure, activity limitations, and also participation restrictions. When this data is collected, this will establish a diagnosis, prognosis, and plan of care. The severity of the patients vary, so the examination process will also vary. Therefore, it may be as lengthy as necessary. Sessions may last between 30 to 60 minutes and 1 to 3 days a week. You should attend a physical therapist until you are stable and your goals are met. Typically, it takes about 6 to 8 weeks for soft tissue to heal. If you have more serious and progressive conditions, it will take much longer. Evaluating a patient may seem daunting enough, but physical therapists also have more obstacles they deal with. Physical therapists deal with a variety of obstacles many ever really think about. There are very significant demands that come with being a physical therapist. A physical therapist is often tasked with physically supporting the patient as they complete physical therapy. They are often required to lift patients out of their bed and assist them as they walk during their treatment. Throughout the treatment phase, the physical therapists are on their feet, guiding the patient to achieve their physical health objectives, and can result in lethargy and soreness from the consistent long hours of 9 to 5. Emotional stress can occur when dealing with various personalities and situations. Patients are dealing with health obstacles, traumatic events, or prolonged illnesses. This can be frustrating for the patient and can be taken out on the physical therapist. According to the challenges of a physical therapist, it is also hard to connect with patients throughout the treatment process which can elicit emotional strain. Also, the patient may be in a tremendous amount of pain, and this may cause the relationship to be disconnected. There are a variety of different patients that come get treatment for a physical therapist, such as children with developmental delays, elderly who have trouble with their basic functions, as well as people who are injured severely. This all can be emotionally stressful, especially because you want to be beneficial in patients' lives. Obstacles are going to be a factor in many professions, especially physical therapy. But planning exercises is one of the most important factors to decide the best route their patient will take. A very important part of treatment planning in physical therapists is effective goal setting. Before the initial examination, the physical therapist should identify the patient's goals and objectives. You want to be able to establish and maximize outcomes for the patient. The physical therapist will need to establish realistic, achievable goals to guide their patients. The physical therapist then decides how to best implement exercises to get the patient where they need to be by evaluating the functioning, mobility, and range of motion of the patient. Based on the evaluation and assessment of the injury, you will be able to determine what the patient can or cannot handle initially. You will also need to identify the limit for time and pressure for the injured area, so the particular injury won't worsen with the physical therapy. All of these factors are just some things to consider when pursuing a career in physical therapy, or if you will need a physical therapist sometime in the future. As you can see, physical therapist is not as simple as it may seem, but very complex with multiple obligations. Physical therapy consists of obligations such as in-depth evaluation, planning individual workouts, while also dealing with major obstacles and emotional strains. Overall, physical therapy is extremely beneficial. Ow! I think I have been standing too long. I'm gonna have to go see my physical therapist. Thank you.